you suspect you may have caught gonorrhea, or just like a general checkup, you can go to your GP, or better still, to a sexual health clinic where you can get the results straight away. Gonorrhea can be treated with antibiotics, so the sooner you go and see a doctor, the better.
Of the many sexually transmitted infections, or STIs, gonorrhea is the second most common. The most common STI is chlamydia. Chlamydia. And we'll talk more about chlamydia later. Right now, let's focus on gonorrhea and why these two happen together. These two diseases often occur together for two reasons. First, they have similar risk factors, which include things like having multiple sexual partners and or having frequent unprotected sex. The other reason is that infection with one of these bugs makes your body susceptible to a second infection by dampening the immune system. So I promise we'll go into more detail about chlamydia later, but for now, let's talk more about gonorrhea. It's caused by a bug referred to as Neisseria gonorrhoeae. And the reason why we call gonorrhea a sexually transmitted infection is because it undergoes this process referred to as transmission, where it moves from one person to another by several mechanisms. Most commonly, gonorrhea will be transmitted through sex, which can include oral sex, vaginal sex, or even anal sex. Another important mechanism of transmission includes childbirth.
So it is said that even Battymen can catch gonorrhea. You hear that? All Battymen can catch gonorrhea because it can transmitted through the anus. That means not even the Battymen them safe. Not even the Battymen them safe. Not even the man them where decide say them nah go the required way, them a put them mouth down there. Them can't get it too. Everybody once you're involved in a what them call unprotected sex, you can catch gonorrhea. Why may I tell you? Listen.
And we'll talk more about the outcomes of that in a minute. So these are the main ways that gonorrhea can be transmitted. So let's move this off to the side and let's focus instead on my poor friend over here who's going to have all the different signs and symptoms a person can get with gonorrhea.
Listen
now,
to this,
because we said the main way gonorrhea spreads from one person to the other is by sex, let's start by focusing on signs and symptoms at our sexual organs. So here you can see on the left, I have female genitalia drawn out, and on the right side, we have male genitalia drawn here. So if we were to imagine our gonorrhea infection, so I'll use this as sort of a way to mimic gonorrhea as it spreads. Perhaps you can have a female infecting a male with gonorrhea, and so because the penis is used during sex, that can actually seed or spread up the urethra. So this yellow line here, that is your urethra. And we'll go into this in more detail in another video, but the gonorrhea bacteria will latch onto the walls in your urethra. Your urethra is lined by epithelial cells. And so this bacterium will enter those cells. That will trigger an immune response. Your white blood cells will detect that something is wrong, and they'll come up to the urethra through the bloodstream to attack wherever the gonorrhea has spread. So if the gonorrhea has only entered a single epithelial cell in your urethra, it'll cause that cell to die in a process that's referred to as apoptosis. Maybe you've heard of it. It's where the body specifically decides to kill a cell because it's doing something wrong or it's been infected, like in this case. Now, in the world, the white blood cell will kill off this one epithelial cell in the urethra that's been infected, and we'd be done with the infection. But oftentimes there are multiple organisms that kind of spread along the urethral tract, which cause more white blood cells to come from the bloodstream to attack the bacteria or the cells that are infected. And as a result, you get inflammation. Inflammation of the urethra, causing things like pain when you urinate, maybe some burning that's there as well, and general discomfort. So because of the bacterium, your urethra will cause you a lot of pain, and you've got what's referred to as urethritis. If the gonorrhea